hope I don't get any unexpected deliveries today.
It happens. As will be if we get any deliveries. The dog will start barking.
I don't have anything I'm expecting, but I can't speak for the people who live above me.
Hi, everyone. We'll get started in a couple of minutes. We were both just saying that hopefully no deliveries or anything unexpected happens in the next 2 hours, but we can't promise. You may hear my dog barking in the background. We'll wait about 1 more minute and then we're going to get started.
I see some questions in the chat about the recording. Just wanted to let everyone know that we are recording this session, and after it is done, I will send a follow-up email with a link to that recording along with the slides and any resources that we mentioned today.
Okay. I still see a few people coming in, so. We've got a really big turnout for this webinar, which we were just saying before, definitely sends us a message, tells us something I think about this topic. So we are going to go ahead and get started. So welcome back, everyone, or welcome if this is your first session with us. This is the 5th workshop or webinar out of 6 that we're doing on supporting small practices in California around ACEs and trauma. So this one is entitled Staff Wellness, Vicarious Trauma, and Burnout. Is it real? What are the differences? So next slide. So just as a quick reminder, we have conducted 4 other webinars, and you can find those recordings on the PCDC website. We can also probably add the link to the chat at some point. I can do that once my co-facilitator takes over. And we're going to have one more session after this one. Our last one, which will be on March 18th, is going to be around intimate partner violence and all too common trauma. So I think that one will also be a great session, and I hope you'll join us. Okay, next slide. So I don't want to take up too much of your time, but I just want to do a very quick intro. I'm not going to do the normal kind of longer one that we've done because a lot of you have been with us for past webinars. So my name is Yael Lipton. I work at Primary Care Development Corporation. We are a national nonprofit. We are based out of New York City, but we have offices in California, DC, and we have some other folks who work around the country. Our mission is to improve primary care in underserved communities. I am a lead trainer and curriculum development specialist, where basically I do a lot of training for healthcare providers throughout the country on things around trauma, team-based healthcare, care management, health literacy, motivational interviewing, team-based healthcare, things around sexual and reproductive health. And I'm a health educator by training and spent many, many years providing direct services in underserved communities in New York City. And also, have worked with many different organizations throughout the country around some of these different topics. So I'll just have my co-facilitator, Angela, quickly introduce herself and we'll get ready.
Hi, everyone. Good afternoon. My name is Angela Fernandez. I'm currently the Assistant Director for Mount Sinai Hospital Sexual Assault and Violence Intervention Program based here in New York City. Our organization provides free and confidential services specifically to survivors of sexual violence and intimate partner violence, advocacy, education, and training around those topics and so forth. And I've been with Savvy for, I don't even remember now, maybe 12 years, actually 13 years. And started my career as a sexuality educator with Planned Parenthood, and actually that's where I met Yael, and have been, in the world of public health and specifically around women's health and reproductive health topics for many years, and then pivoted specifically around trauma. And it's been really wonderful to facilitate this series, really to start to awaken the healthcare world around trauma, and really happy that we're finally able to talk about the intersection between trauma and health outcomes. So yeah, happy to be here.
Thanks. Next slide. So we have a lot to get through today. We're going to talk about vicarious trauma, compassion, fatigue, and burnout. We'll look at the prevalence of it. We'll look at the similarities and the differences between those three things, which get used interchangeably quite often. We'll look at what the signs are of these various things. We'll explain really specifically how staff wellness impacts patient care, although I'm sure you all pretty much know that from your own experience. We'll look at ways to mitigate the risks of these things as well, on both individual levels, so things people can do on their own, but also organizationally wide. And we'll really talk about how staff wellness is really a very important part of trauma-informed care. So next slide. We're gonna actually put up a little poll just to see how people are feeling. This is gonna be anonymous, so when you choose your responses, nobody's going to know, no one's gonna know what you wrote. We're just gonna get like a total tally. So in the last year, have you struggled with motivation? Okay, next. Or Kimmy, you'll just put them up, yeah.
So they're going to come up one at a time. Do you want me to show you the results of each question as we go?
Sure.
Okay.
Okay, so most of us have been struggling with motivation. Me too. All right, let's see what next. Have we struggled with patience? Being patient, not working with patients. Again, an overwhelming majority of us have. Okay. In the last year, have you struggled with your mood? Right? Has it been different than in the past? Again, Many of us. Okay. In the last year, have you struggled with feeling empathy or compassion for patients? If you don't work directly with patients, you can substitute that by saying colleagues, family, whoever you're stuck with at home.
Humans.
Yeah. Right. All humans. Okay. So that's really interesting. So most of 60% of us have not struggled with that. So that's good. All right. One more. So in the last year, have you noticed signs of vicarious trauma, compassion fatigue, and or burnout in one or more of your colleagues? Oh, wow. Okay. So this is the highest we've had. So we've seen it. We've been able to identify it in others. Okay. Thank you all so much for participating with that. Okay. So if you answered yes to any of the above, how have your colleagues or your organization responded? Can you just use the chat box? And let me just remind you that when you're using the chat box, if you want to make sure you address it to all panelists and attendees, that way everyone can see what everyone is writing. So how have you responded, or how have colleagues responded, or how has your organization responded? Any thoughts? Taking time to check in as a team, staff meetings specifically dedicated to this topic. Great. We encourage to practice self-care, and our behavioral health manager has offered his services for staff. They're coming in so fast. Employee assistance departments recommending vacation, well-being seminars, taking a break, spending time with family, check-ins at work, training staff on all this stuff. Our organization added a stress management component. The administration isn't sure what to do, is perhaps overwhelmed, exhausted themselves. Yep. Slowing down. That's nice. One organization pays staff 1 hour for self-care time each week, leaning on behavioral health. My organization has started giving 4 hours off per month for COVID relief. EAP, morning huddles, listening. These are great. Witness to witness program. I don't know exactly what that is. All right, so a lot of stuff, and I'm seeing some things that are repeating, which makes total sense. Anything we should pull out, Angie, that you could see? Use PTO, mental health check-ins. Yeah. These are all really good. This is encouraging.
We'll be going into more around this later. So this is very much in line with what we'll be covering today. Looks like some people haven't had as positive of a response or experience. And when we get to those specific topics, then it would be great for people to chime in again, and we can, I think, get more into that as far as like, what do you do when someone needs to be asked to take additional time off, et cetera, as a supervisor.
Great, thank you. All right, next slide. So let's dig into what these things are, right? The similarities and the differences. So next slide. So I love to start, oops, sorry, I just did something to my screen. Here we go. So I love this quote, and I love to start this session with this quote. Rachel Remen is an integrative medicine doctor and professor in California. And this is really so true, right? The expectation that we can be immersed in suffering and loss daily and not be touched by it is as unrealistic as expecting to be able to walk through water without getting wet. So I love to just repeat this, that we absolutely cannot become trauma informed for patients if we're not trauma informed for each other and in our places of work. And we cannot do this work without it affecting us. So it's normal to be affected by it, right? How we respond to its effect is the challenge, right? Both on the individual level as well as the organizational one. Okay, next slide. So just, I think this is really interesting for some historical context. Maybe some of you already know this, but burnout, right, is a combination of exhaustion, cynicism, and perceived inefficacy resulting from long-term job stress. It was first described in 1974 by the clinical psychologist Herbert Freudenberger, who volunteered at a free clinic in the then drug-ridden East Village of New York City. Over time, he observed emotional depletion and accompanying psychosomatic symptoms among the clinic's volunteer staff. So, the thing to know about this is that this is not just about working in healthcare, right? You can, any job really can experience, people can experience burnout. And it's really the exhaustion and disconnection that people experience when your job satisfaction is low and you feel powerless and overwhelmed. So stressful conditions that are often the cause are things like unmanageable workloads, insufficient pay, unrealistic demands. But we will cover that more in a minute. Next slide. So let's look at some general burnout rates. So in one Medscape News survey where 15,000 physicians responded, they found the overall burnout rate was almost half, 42%. Almost half of resident physicians experience burnout. 98% of medical professionals agree that it's an issue. 40% of physicians are reluctant to seek mental health treatment. 40% of doctors with burnout say they lack resources in their job, which contributes to the burnout. And just for some context, over half of doctors work 50 to 80 hours per week, right? So even with these high stats, generally the healthcare industry has not done a great job addressing this. We don't see widespread programs or tons of research on it. And obviously the COVID-19 and the pandemic has potentially taken this to a new level. Next slide. So here we see that a third of nurses have high burnout and that doctors are up to their eyeballs in debt, which is certainly a cause of stress, and they feel they don't get paid well enough, obviously in certain specialties. So what might be causing this? Nurses and docs spend about half of their days on their electronic health records. This really shook me, really shook me. I just want to let that sink in for everyone. Half of our days spent catering to the computer. So people go into these professions because we want to heal people, we want to take care of people, and we in fact just spend half of our time caring for the computer. So this has to have an effect on morale. And almost half of healthcare workers are not getting the 7+ hours of sleep that are needed. And sleep is a must, right? We know this, we must sleep in order to function well. Next slide. So what else drives burnout? Certain specialties see higher burnout rates, like emergency medicine, general internal medicine, and neurology. And I thought the last two were really particularly interested. Being a woman in medicine and having children under 21 is a factor in burnout. I don't want to jump to conclusions, but I have to assume that some of this is about women still carrying more of the load, right, around children and home. And of course, good old-fashioned gender-based discrimination. Some of you may have seen the New York Times has been doing a piece or a series on, what is happening to mothers basically during the pandemic. And they've looked at it from many, many angles, but millions have had to drop out of their jobs and of the labor force just to care for children and families. So certainly that's really real. Okay, next slide. So this is not surprising, right? Burnout during COVID-19, but it's also very troubling, right? As we need you, all of you and others to be able to continue our jobs for the health and safety of everyone. Obviously, the emotional exhaustion from caring for people with COVID who are unable to have their loved ones visit with them has taken a real toll on nurses and other healthcare staff. This is not really related to the presentation, but I really think we need to rethink some of our visiting policies for the sake of both patients and staff, right? We just can't expect nurses to continue to be the last people patients are seeing before they die. I think it's too big of a burden for anyone to bear. Anyway, that's just my 2 cents there. So, they're worried about the things that we've heard about, right? Exposing their children, their spouses or partners. This may be a little bit different now that many of them have been vaccinated. And among people with children, half reported that they're lacking quality time or unable to support their children or be a present parent. Emotional exhaustion was the most common answer for changes in how healthcare workers were feeling, followed by sleeping problems, physical exhaustion, work-related dread, right? Changes in appetite, headaches, stomach aches, things like that, compassion fatigue. Okay. Nurses reported having a higher exposure to coronavirus, and they were more likely to feel too tired compared to other healthcare workers. Next slide. So just a little more evidence that COVID is having a huge impact on healthcare staff wellness, that people didn't feel like they have enough emotional support. And, uncertainty, the top 3 work-related stressors: uncertainty about when things will settle down or return to normal. Over half experience burnout, and the increased workload. Next slide. So this is just a quick model that can help us understand kind of the stages that people go through in burnout. And I'll just try to, summarize it, pretty quickly, but there are these 5 stages: the honeymoon, the onset of stress, then chronic stress, then burnout, then habitual burnout. So if we go to the next slide, we can go over a little bit about what happens here. So in stage 1, or the honeymoon phase, when we undertake a new task, we often start by experiencing high job satisfaction, commitment, right? Energy, creativity. This is especially true if it's a new job or a new role. So during this stage, people are really committed. They want to prove themselves. They have high job satisfaction. They want to accept new responsibility, and we have a lot of energy. The second stage, when the onset of stress happens, begins with an awareness of some days being more difficult than others. You may find your optimism waning, as well as notice common stress symptoms affecting you physically, emotionally, mentally. So some common symptoms in this stage are just anxiety, avoiding making decisions, changing in appetite or diet, being tired, forgetting, grinding teeth at night, having trouble focusing, headaches, problems sleeping, and more. The third stage is this chronic stress stage. This is marked is a change in your stress levels. So going from motivation to experiencing stress on an incredibly frequent basis. You may also experience more intense symptoms than those in stage 2. And symptoms in this stage can range from anger to apathy to exhaustion, missed deadlines, feeling threatened or panicked, feeling pressured, using more alcohol or drugs to cope, being sick more. Entering stage 4 is burnout itself, where symptoms become critical. Continuing as normal is often not possible in this state, as it becomes increasingly difficult to cope. We all have our own unique limits of tolerance, right? In this stage, it's really important to get help. People may be getting chronic headaches. They may have GI problems. They may neglect their personal needs. They may feel empty inside, a desire to drop out of work and society, social isolation and self-doubt. And the final stage of burnout is habitual burnout. This means that the symptoms of burnout are so embedded in someone's life that they're likely to experience significant ongoing mental, physical, and emotional problems, as opposed, right, to occasionally feeling some of these things. So there may be chronic sadness and just really draining mental and physical fatigue and depression. So this is helpful for me to understand how this works. Okay, next slide. So just quickly going into some of the definitions, compassion fatigue refers to the profound emotional and physical exhaustion that healthcare workers can develop over the course of their careers when they're unable to refuel and regenerate. They may notice a change in their ability to tolerate strong emotions in their patients, colleagues, and loved ones, or listen to difficult stories, right? I can't hear anymore. Over time, they can sometimes become detached and lose the ability to connect with patients. And researchers have found that compassion fatigue is a normal consequence of working in high stress settings with heavy workloads. And it can also result from being exposed to too many patients with similar problems. Okay, next slide. The terms secondary traumatic stress and vicarious trauma were coined by researchers who noticed that those in the helping professions were often profoundly affected by their exposure to indirect trauma. So symptoms of post-traumatic stress can appear in some staff members, even if they have not themselves been in danger or in the line of fire. They report experiencing intrusive images, nightmares, preoccupation with stories from their patients or clients long after the encounters have taken place. And over time, they may develop this vicarious trauma, which is a shift in how they view the world, right? One terrible story or thousands of them may become deeply embedded in the soul, to the point where it changes our sense of safety and makes us more anxious and more fearful about specific situations. I was recently working with a group of nurses who told me that for them, every motorcycle is a donor cycle, right? They've seen so many accidents, so many victims with brain injuries that they no longer believe riding a motorcycle is safe. Although I don't know if it's that safe either, but vicarious trauma can lead to a loss of innocence and interferes really with our daily lives and our ability to go on. Next slide. So it's common, right? Up to 85% of helping professionals develop or can develop vicarious trauma. And 1 in 5 psychologists even report having suicidal thoughts while confronting a personal or professional difficulty. Next slide.
Okay. Thanks, Yael. So, I don't know about you, but thinking I identify with a lot of those feelings.
Yeah, it's a lot, and it's a lot to get through.
Yeah. So now we've laid the groundwork, and a lot of you already, I think, like Yael said in the beginning, the number of people who signed up for this training and just how active the chat is that I'm seeing, which is wonderful, really speaks to the need for the isolation that can occur when you're dealing with or experiencing some forms of compassion fatigue or vicarious trauma, and just and specifically in healthcare, where most healthcare professionals or helping professionals, we would say, right, that we go into this work wanting to help, wanting to support, and oftentimes that means almost disconnecting from the human elements of ourselves, right? And so we've just become this absorption of people's pain, of people's suffering, and that can be a very dangerous place to be. Next slide. So this is one of there's a whole lot actually, which is pretty cool, around vicarious trauma, around compassion fatigue. I think in the last probably 5 to 8 years, I think that we're finally starting to see how important it is to talk about vicarious trauma or secondary trauma when we're doing work with our patients, with clients. And for a long time, I think that we've understood this in a more therapeutic place, but it's finally, I think, becoming so clear. And unfortunately, the pandemic really highlighted this, of what this means for healthcare workers who are in this, who are absorbing all of this pain and suffering, and also needing to carry that for others while also caring for others, right? So the trauma exposure response, and I really, we're going to talk more about Laura Vandernoot Lipsky, who is, she is in the trauma field. She's kind of like the guru around trauma and vicarious trauma, and has really laid out, I think, some great resources that help us to understand what this means, but also a guide to be able to move through trauma, vicarious trauma, and how to rebalance ourselves so that we can continue to do the things that we really love, which is taking care of others, right? So the trauma exposure response is the transformation that takes place within us as a result of long-term exposure, usually of suffering of other people, right, on the planet. And that this can result from deliberate or inadvertent exposure, right? So we could be doing direct trauma work. We could be doing, assessments and intakes and really looking for the experiences of others, but also this can be inadvertent in just the daily work of talking to people, connecting with people, and becoming very personal with people. And I don't think there's anything more personal than someone's health care, right? And just like Yael already spelled out, this really is a nice visual to look at all of the ways that trauma exposure response can work. So everything from feeling helpless and hopeless, diminished creativity, hypervigilance, right? So always, like Yael was saying, just really looking at the world in a way of being ready to be defensive as that threats are constantly there. The inability to embrace complexity, right? So that feeling of just everything becomes overwhelming, all the way to anger and cynicism, and then things that we start to see more in, behaviorally around addiction, substance use abuse. And then the grandiosity, which I think is so important to talk about, which is the inflated sense of importance, of really feeling like if I take, and I don't know if any of you relate to this, but there are times where it's like, if I have to take a day off, what's going to happen, right? This feeling that we are just truly carrying the weight of the world, and that we are responsible for that, so that we really can't step away. We really can't take time for ourselves. Someone wrote in the chat earlier that one of the things that their organization or leadership are doing was really encouraging people to take time off. And the comment also included saying, and not feel guilty. And I thought that was such a profound point, right? That most of us do get some sort of vacation time. It's part of the work. We earn it. It's our time, but feeling guilty to actually use it for ourselves, right? Next slide, please. So we already went through a lot of this, but again, just in thinking about the differences, the signs of compassion fatigue, and especially when 92% of you said that you've seen some of these signs or symptoms in colleagues, right? So thinking about this, that trouble sleeping, feeling irritable, feeling detached, the self-blame, which is, just I could have done more, or always feeling like you can't do enough, right? Nothing is good enough, nothing is enough, all the way to more of those somatic types of symptoms, the nausea, dizziness, self-medication, and then how this really bleeds over into our personal lives with our relationships, right? More relationship conflicts with family, with partners. And it, it looks different for everyone as well. Next slide, please. There is a difference, right, between vicarious trauma and compassion fatigue and burnout, and they're all very similar, and they oftentimes can overlap, but there's also a difference between it. So vicarious trauma, we really start to see people mirroring trauma and a lot of PTSD symptoms that may be coming from hearing disclosures, hearing about trauma, and just the saturation in this. So we start to see people really kind of that world shift that we talk about all the time, and we've talked about this in our past webinars as well, of just like the lens of the trauma, right? The experience of trauma lens versus versus somebody who's more in a healing process are very different. So the trauma lens is really one of is very dark, right? It's the glass half empty type of viewpoint. And we see all of the same things that someone who has directly experienced trauma starting to happen. So the guilt, loss of hope. And we highlighted the alter state of self and world. There was a question earlier around moral injury. And when we start to truly change and the way that we see the world changes, that also impacts, our values, our morals, how we feel about ourselves, how we feel about others, how we feel about those who are in positions that are supposed to be taking care of us, right? A lot has happened in the past year with the pandemic, with the political environment, and many people are feeling, more than just, the normal kind of annoyance or frustration, but that we have collectively really been living through a lot of trauma as well. Next slide, please. So what does this mean for individuals and impact on staff? I really like these images, and we're talking about something very serious, but I think that using humor sometimes is also a really helpful way to practice self-care and kind of combat some of that compassion fatigue. So we see the zebra losing the stripes, and then we see the other image where someone, there's a dog in the water saying, "Lassie, get help," and then Lassie is on the couch in the therapist's office, right? So again, just really what all of this does to us, but also kind of shifts the way that we are taking in information and interpreting the information, right? Depending on where we are at. But truly, it impacts us body, mind, and spirit, right? Next slide, please. So what are some of the risk factors? Well, for the sake of a PowerPoint, we're trying to make this very succinct and put it all on one slide, but there's a ton, and also there's only so much we can take as humans, honestly. So some of the things that we do know, though, the professional risk factors, right? And a lot is what you've already mentioned in the chat, which is lack of quality supervision. When we don't have guidance, when we don't have a place where we can lean on, and when we don't have kind of that stability and really the safety in good supervision, that is going to exacerbate these feelings, right? Just the way that we've talked about in the past webinars, as far as how do we provide good trauma-informed care to our patients? Well, we want to create safety and transparency, right? We want to we want our patients to, we want to re-empower or empower our patients to be able to have a voice. Well, the same thing applies to staff. So as a person who is, as a staff person in the work, we really need those same things, right? And so trauma-informed care truly requires a trauma-informed organization, right? So we cannot do for others what we're not receiving and doing for ourselves. A high incidence of trauma among our patients, our caseloads, is a risk factor, right? It's just saturation when we're in it to, and there's no kind of outlet for it, then we're higher at risk for compassion fatigue and eventually vicarious trauma. Little experience, and you put that there, if people who are maybe newer to the work, or maybe you're in a new role, you're working with more acute or complex patients, then we're more at risk, right? Because it's new and we haven't figured out that balance of centering ourselves and taking care of ourselves and being able to care for others. When there are cultural clashes between patients and the organization, when that just is creating a lot of conflict, and that when we're anticipating a lot of conflict or confrontational interactions with patients, that already sets in, again, that unsafe kind of environment for staff. And the same goes when it's a worker or organization mismatch, right? Our values are something that are so key to being human, and to feel, it's really important, especially when we're doing anything that's involving trauma and supporting others. We have to really feel that the organization is aligned with our own values, right, and our goals, and who we are as people, right? It's fine to be different and to disagree a little bit, but at the core, we really need to feel good about the work we're doing in the organization to which we belong, right? Because that's also going to reflect how we're treated as staff and as part of that organization. The lack of professional support, inadequate training and preparation for the role, right? And then a work environment that rewards going above and beyond. And I see this because, and the reason why we use these images here, and I saw it in the chat, especially this past year, where healthcare workers, and if I see the word hero one more time, it is, healthcare workers are heroes. But when we do that, right, what does the word hero really imply? It implies someone who's not necessarily human, right? It's superhuman. It's maybe not even mortal. And I think that although that feels good and it's meant to mean something really wonderful, it can also put a lot of responsibility and expectation and unrealistic expectations on individuals, right? And it really sets us up to be able to not be a hero, right? So if you are struggling, if you need help, if you have a question, then what does that mean if you are expected to be this hero, So I was thinking about this today, and I was like, what would be other good ways to honor the incredible work our healthcare workers have been doing and do, right? How about, special, exceptional, valued, acknowledged, right? Important. But in an environment that rewards kind of going above and beyond, people, when people are rewarded for never taking a day off, that is risky, right? On the personal side, things that probably won't be a surprise, if someone who already has a trauma history, then when we're in conditions that are really challenging us, that can be triggering. When you struggle with boundaries between personal and professional life, I think this has been a huge challenge for a lot of us since COVID. The working from home, or the hybrid situations, or needing to check your email because things are so fluid that they're changing all the time. And so now we're maybe checking emails and checking messages during off work hours, and that becomes, an expectation. The lack of experience, again, due to age or in a role, and it really goes back to kind of knowing yourself, knowing the signs of when you might be struggling, right? And with experience, we, supposedly get better at that. And then, of course, isolation and inadequate support. And then again, going back to that superhuman complex that cannot fail, right? And most people who are in the fields of caregiving, healthcare, helping professions, usually we play a similar role in our personal lives as well, right? And so people are coming to us, people are needing us. We get something from it. It's not a bad thing, but it also means it's harder for us to let go or to recognize when we're having a hard time being that person for everyone. Next slide, please. So this is just you'll have these slides, so I won't go over all of this again, but I thought this was really helpful just to kind of show what we're talking about and the similarities and the overlap, but also some of the things that might be different. And so, when we think about burnout is usually from, it's coming from the burden of work, period, right? And so people in all kinds of professions can get burnout, and it has a lot to do with the organizational structure and roles and all of that, right? When we start to look at compassion fatigue and vicarious trauma, it's definitely, we're talking about professional roles, but we're also talking about things where, it's specific. You are being exposed to trauma, right? And it's secondary trauma. And so you are in a role where you are hearing, absorbing, carrying, holding space for the suffering and the experiences and the pain of others, right? And usually, and the reason why it's important, even though we use these terms interchangeably, it's important to know if it's burnout or more around compassion fatigue or vicarious trauma, because that's also going to inform us what the solutions could be, right? Next slide, please. So Yael really mentioned a lot of this earlier, and I think that this was when she was talking about COVID, but in general, we know that physicians suffer from depression and suicide at higher rates than many other professions, and that it's estimated one physician dies by suicide each day, and that 15 to 30% of medical students and residents have depression. That this has become kind of almost like an occupational hazard, but I think that it's important for us to see that there are a lot of things we can do to combat this and mitigate it and prevent it, and that it doesn't have to become something that's just part of the job, right? But that also means dismantling a lot of the systems and the way that that we've kind of designed what a provider is, the training, even looking at the reasons people want to go into this field, right? So it's not something that you can just change overnight. Just like becoming trauma informed is not something that happens just from one webinar or two webinars, but we're really at the ground, this is at the ground, right? If we're not talking about it, thinking about it, making these connections, then we really can't change anything either. Next slide, please. And then of course, for those of you who are saying you wanted to take these slides back to your staff or even to your leadership, and sometimes, talking about your own well-being might not be enough, that we have to also see this is important practically because it impacts patient care, right? And so the healthcare field, healthcare organizations really need to care about this and invest in this, because the bottom line is it will have a direct impact on patient care, not just on staff, right? And so I don't think anyone will be surprised to see that we know that when our physicians, when our nurses, when our frontline staff and healthcare organizations are suffering from compassion fatigue or burnout, that is going to cause strained relationships between patients and providers, right? It's relational. When we don't have the resources to be able to have compassion, when we are losing patients, when we're feeling frustrated, when we're feeling resentful, we can't be present and we can't fully engage with the patients, right? That's obviously going to lead to decreased quality of care, that will have worse health outcomes, right? It can possibly put patient safety at risk and lead to more medical errors, more malpractice, and overall reduced patient satisfaction, right? I can't remember, every time I use this analogy, someone always says, I've always said that before, and I don't know if it's the FAA that's truly responsible for this, but when you go back to, well, many of us probably haven't been on a plane in quite some time, so I'm assuming they'll still do this when we can all fly again, somewhere wonderful as part of our self-care. Right, that when you are on a plane, they always say, right, that first, if the oxygen masks come down, then you need to make sure that it's put on, you position it properly, and that you take care of yourself first before you can help others that you might be traveling with, or just somebody you're sitting next to, right? And it's really the same thing, that as the caregivers, as the staff within the organization, if we are not in a good place, if we don't have enough oxygen for ourselves, then it's certainly going to impact the people that we're trying to care for, right? Next slide, please. And so organizationally, when the people who make up the organization are struggling, then of course the organization is going to struggle. We're going to see higher staff turnover, right? And the resources needed to hire, train, drains remaining staff. So those of you who've been in a position like that, when people leave, right, and the work still needs to get done, it impacts the people who remain in the organization as well. And it's an output of resources when you have to hire and retrain new people. There's erosion of focus, decision-making, motivation, performance in general. And the people who are at the top, executives of, the CEOs, they're not immune to this either. But oftentimes it's hard to get people in those roles to acknowledge, again, going back to a little bit of that superhuman complex, right? So I think someone earlier said, that their leadership was trying to do things to help support during, around compassion fatigue, but that they thought that their leadership was kind of struggling themselves, and that's absolutely true, right? And then eventually it will lead to lost productivity, decreased morale, decreased cohesion, and poor quality of services, right? So the overall health of the organization will be is impacted. Next slide, please. Okay, so what do we do about it, right? We certainly don't want people to walk away here feeling even worse than they did before, but hopefully people are feeling validated that, a lot of what you may be experiencing right now, many of us are experiencing right now, you're not alone, and that this makes a lot of sense, right? That there's nothing wrong with us when we need some support, because it's just a natural part of being human. So what is self-care? So I was saying earlier, humor is important, and I will admit that sometimes, sarcastic humor is a way that I definitely help to make myself feel better at times. And like I said before, I work in a trauma-specific organization. And I've teased some of my colleagues about self-care because I've been like, oh gosh, self-care, that just means, something else to add to your to-do list, right? And that it's, a gimmick, and that there's a ton, everything's about self-care, commercials and products. And, I need to buy this new lipstick because that's a part of my self-care. But self-care actually is essential, and it's real, and it's important. Yes, self-care equals me time, absolutely. So self-care is giving the world the best of you instead of what's left of you. And I really like that phrase, right? And so what is it that we need to be able to be our best rather than just kind of getting by? Next slide, please. So, there's not a whole lot of rules around what self-care is, but it really is any sort of activity that we do deliberately, right? In order to take care of our mental, emotional, and physical health, right? And it should be they should be activities or time or things that help to improve our mood, reduce anxiety, and really self-care is absolutely essential to good relationships with ourselves, and gives us the ability to be able to be good in our relationships with others. self-care should not be something that we force ourselves to do. It should not be another burden. It should not be something that we judge ourselves for. And it should be something that refuels us rather than takes from us, right? So it's going to look different for each of us, and it's going to look different for us depending on where we're at in our lives and what we're struggling most with. You know, and that usually self-care tends to the whole person. So it's psychological, emotional, spiritual, intellectual, interpersonal well-being. And, you know, there's a ton of things that we can do, small and big. But I do want to just emphasize that it should be deliberate. It should be, you know, on a regular basis, and really shouldn't be something that we compare to others, right? Next slide, please.
Can I interrupt for 1 second?
Please.
I was thinking that, you know, one of the challenges of this right now is also that so many of the things that people have done for self-care are not available to them right now, right? Like if you like to take exercise classes in person, you know, maybe that's not something you can do right now. Or sometimes when you're outside of work, depending on what your home situation is, that could even be more draining than your actual work. So I just wanted to put it out there that you almost have to redefine self-care during the pandemic, right?
That's such a good point. Yeah, you know, and it's definitely right. We're all struggling because things have been taken away from us, and we do have to find other ways, and we have to be creative, and it might look different now, which does become a struggle, right? And probably the reason why for many people, many of us, self-care has been probably the first thing that we've let go of doing, right? I know we already did a poll before, and part of your self-care is to not keep you all on a webinar for 2 straight hours. So I just, you know, rather than waiting for people to write in, I will just have you think about this, and if we have time at the end or people who stay later, we can talk more about this. But you know, like really thinking about some of the self-care practices you use or have used in the past, or things that, you know, that have you've assisted your colleagues in experiencing symptoms of compassion fatigue. I think that it's sometimes easier to recognize what, you know, what would be helpful, and when someone really needs to take more time for themselves in others than it is probably for ourselves, right? And that's probably why most people were able to identify something going on with their colleagues, because usually we're more keen to help support our colleagues, because what we do for others usually is not the same rule we apply to ourselves, right? Next slide. So I'm just going to go through these very quickly. Really, these are here just to give you examples that there are actually a ton of tools out there. If you're a tool type of person, if you're somebody who likes, you know, lists and handouts and things like that, which I am the first to admit, I am one of those people that you know, that it's helpful to have some concrete ideas. We want to put a few up here, and we did also at the last slide here, we'll include some links to resources where a lot of this stuff comes from. And you'll also have these slides as well. So this is a great tool, because I like this. It's a lot around personal reflection, and it's helpful to really think about this as far as, you know, what are your top 3 work related stressors, your top 3 personal stressors, and then it helps you to really go through and think about things that might work. And what I really like about this one is at the end, it talks about list the first name of coworkers who are part of your work related support system, right? So, you know, who are your go-to people, you know, at work, in your work, right? That, you know, you have each other's backs, because, you know, we don't have to be best friends with the people that we work with, but we certainly do rely on one another, and we have to feel like we can, right? And so I really like this one because it's a question I don't normally ask myself. I can list all those people in my personal life, but not necessarily in my professional life. Next slide, please. And here's more. This one helps to address, okay, we all have coping mechanisms, right? We are all human, and that's the wonderful part of being human. We are designed to survive, right? So some of the things that might be helping and that you might say that's your self-care might not actually be so good for you. So this is a really great kind of a questionnaire for you to answer and think about for yourself as far as like when you are under stress, what are the things that you usually go to help? And to really look at how much is more on the unhealthy side that's not really going to help us long term versus what are the things that are more, you know, healthy lifestyle behaviors. But take work, right? Take time. So, and I'm not even going to tell you how many on the left side I would say yes to. And I see questions. Yes, you'll get all this. This is in all the slides. We also reference these, and I'm also happy to, you know, you can always reach out to us if you want like more information or a better copy of some of these. Next slide, please. And here's more, right? So there's all kinds. I think this could be really helpful to use for yourself, with your colleagues, if you're a supervisor in leadership, if you want to kind of help to start a conversation. These can, you know, these can be really helpful. Our self-care, there's things that we can do, you know, in our outside of work, and then, but it's something that needs to really translate into our work lives as well, right? Like it can't be that you take good care of yourself when you're home, and then all of a sudden when you're at work or not. So this is really to help to expand, you know, kind of our way that we think about self-care, and then it's not a one-time thing, but there need to be multiple things that you have in place, right? So it can be going and getting a massage, but that can't be the only part of self-care, right? Because we can't always be going and getting a massage, or when you can't go to get a massage. So there's a lot of things that we need to have in place. Next slide, please. And here's some just other ideas. They might seem a little bit silly, but again, just to kind of get you all thinking, what can you do, especially in the workplace that doesn't cost a lot of money, right? It can't necessarily be that you can, lunch gets bought for everyone. We're all on a, you know, tight budgets in our organizationally, but what are some things that might help? So things like taking stock, what's on your plate? Can you rebalance your workload? If you tend to, you know, have a slow start in the morning, or the things that you need to get done that can be shifted from morning to afternoon, right? Just something very, very basic like that. If you want to engage colleagues, can you start a self-care idea collection with coworkers? Maybe you can make it into a little contest, right? Like who has done the most, you know, positive things for oneself. Finding time for yourself every day, no matter how brief, even if that means using the restroom and just staying in there for 5 extra minutes. And trust me, I've done that myself, right? Making sure you have a transition from work to home for people who might be more remote or not going in as often. That commute, as awful as it was, may have been your downtime. And so how do we transition from our work, you know, our work selves to our home selves? Seek out professional development and support opportunities. Not, you know, adding more trainings isn't necessarily going to help some people, right? It really depends on what works for you. But peer support opportunities can be really helpful because you're sharing with people who get it, right? And many of you probably have roles and do work that most people don't understand unless they do the work as well. Next slide, please. There's a lot of discussion around what resilience is. And Yael and I were talking about this too, right? That it's I think this is a hot topic right now as well. When we talk about trauma, we're also talking about resilience. And what is it, right? Next slide, please. So resilience is the process of adapting well in the face of adversity or trauma, significant sources of stress, right? Um, and it involves the ability for kind of bouncing back from difficult experiences, but also can involve profound personal growth, right? Um, that resilience is really a part of our lives and an aspect of ourselves that means that we can go through really difficult times, but that those events don't have to determine the outcome of our whole lives, right? So are we able to um, still grow after, right, and through those experiences? And when we build and when we develop resiliency, it helps us, get through difficult times, but it also can empower us to grow and even improve things along the way. It is not something that one person is necessarily born with and another person isn't, although there are some traits that each of us will have individually that make us more or less likely, right, for this to be something that is a natural um, process for us. But it takes work. But you actually can build resiliency. Next slide, please. So the difference really between resilience, right? So surviving something or enduring something or kind of getting by with something is not resilience, right? And so resilience is really the ability to be larger than other obstacles faced rather than just surviving it. And I don't say just surviving, meaning surviving is an easy thing. I mean that we don't stop there, right? And so resiliency really is growth, and like I said, it takes work. And when we think about resiliency for direct survivors of trauma, it takes work, right? It takes someone working through the trauma and being able to really kind of regain a sense of themselves again in the world. And it looks similar for those of us who um, may deal with vicarious trauma, right? So the components of resiliency really need to be a sense of personal control, a pursuit of personally meaningful tasks, right? So we need to, at the end of the day, have joy. We need to have a sense of purpose and feel content with that purpose, healthy lifestyle choices, and social support. Next slide, please. So in order to have those things, right, we really need to have self-awareness. We are working towards self-regulation. So even in the most challenging times or moments that we are able to regulate ourselves. Self-care is a part of that, and that we are countering isolation. Isolation is very very harmful, right? It can be very harmful, and it's harder to reconnect the more isolated we become. And optimism is a part of resiliency, and that doesn't mean being in denial. It means really trying to look through a lens of hope. And really, optimism means that we feel hopeful that the future will hold more positive experiences, right? So again, it's not in denial. It's not that optimism comes easily. It really does take work and a completely different shift in mindset. And then something called the ABCs. Next slide, please. So the ABCs, so if you walk away with nothing else and you think ABCs, it's awareness, again, it's balance, right? We need the balance and the connection, right? Which is what we've been talking about. That's what self-care brings to us. It helps to bring the balance. It also helps to make it possible for us to refuel ourselves so that we have the resources to continue to do what the work that we're doing. And the awareness is so important because it's if we're not self-aware of what's happening to us and why, then it's really hard to figure out what to do next, right? Um, and with self-awareness and awareness of what's going on, um, we're able to ask for help. We're able to take time off if we need to. We're able to seek those things out. We are also able to recognize, how much is within our control, and then how much do we need to ask of our supervisors or organization to help support us. Right? Next slide, please. So similarly, the organizational resilience building would mean creating a vicarious trauma-informed culture. So is it a culture that encourages self-care, that encourages healthy boundaries, and provides opportunities for peer support and that connection, right? Is it an organization that emphasizes early identification to reduce long-term impact of vicarious trauma? Is it an organization that provides interventions that are multi-leveled and not solely left up to the individual? And that, again, is it an organization that implements the nurturing of awareness, balance, and connections among staff, right? Next slide, please. Some people were talking a little earlier about, experiences with supervision. So trauma-informed supervision, vicarious trauma supervision really has to incorporate these things, right? So a safe space for addressing vicarious trauma, considering peer supervision opportunities rather than just a hierarchical situation when there's a supervisor and a supervisee, right? And really acknowledging that that it's not necessarily a failure of a staff person to need to process some of these experiences, right? That it should be a part of best practices rather than a situation where we are making one or two staff people feel that this is something that is a failure on their part, right? Vicarious trauma-informed supervision really has to think about workload and expectations. And we have to support our supervisors, right? So do our supervisors have the oxygen masks so that they can be there for the people that they're supervising, right? So you're starting to probably see this theme, right? Using self-reflection during supervision can be really helpful. And so what I mean by that is just, really processing what helped get the staff person through that particular event or deal with that particular patient, right? What was coming up for that staff person if it's around one experience or something that triggered them. Exploring what didn't help and then how to learn from the experience, right? So really kind of a processing experience rather than just looking at things from like a quantitative perspective of, is someone meeting their patient load? Did someone do X, Y, Z? But more around what did it feel like for a staff person? Next slide, please. So this is just really more of the same thing that we've been saying. For building resilience, that I can't emphasize enough the connection part, right? We want to combat the isolation, so supporting a support network is really useful. Debriefing after a critical event should be factored into time and supervision and into the workday. Finding healthy ways to decompress. And then practicing mindful-based stress reduction, like breathing and meditative activities, right? And then thinking about your other trauma inputs. What are you reading when you go home or on the subway or whatever? What are you, are you on a Twitter feed right when you're trying to go to sleep? We really have to be mindful of where else we're getting trauma inputs and what does that mean? And how that really affects our ability to manage this with our patients. Next slide, please. This is just a breathing activity. I'm not going to force you to breathe right now. Hopefully everyone is breathing. But when you do get the slides, I really like this one because it's easy, you know, breathing in for 3 seconds, hold it for 3 seconds, breathe out for 3 seconds. And I will say that even my Fitbit says that this works, because when I do this, my resting heart rate actually does go down, and I didn't even realize that it needed to. So that, you know, kind of that adrenaline feeling when you're rushing, when you have a million things you have to do and you've got to go and take care of this person and do this paperwork and all that kind of stuff, that this is something you can actually do while you're at work. And it helps to reduce that fight or flight feeling that we've talked a lot about around trauma. And when we start to go into that mode, we start to go into kind of a reactive mode, right? And we're no longer in control. We're no longer really centered in ourselves. And that can really change the entire course of a person's day. Next slide, please. Trauma stewardship. Next slide, please. Sorry, Kimmy. Trauma stewardship is taken from the book that I was talking about, that really talks about how do we, the concepts of really the management of our resources, right? And the management of our resources when we are also in a place that we have to take care of others. Oh, good. I see some people saying something about this book. So I wanted to put it in here because it is just really a different way, again, of looking at ourselves in this work. And if it's not for you, that's totally okay too. It's a really incredible book though. And trauma stewardship really is the practice through which we as individuals and our organizations tend to the hardship and pain of others in the trauma, right? So really helping to develop a deeper sense of awareness need in ourselves around this, so that we can actually be there for others. And it can be a totally different shift in how we kind of go about our days and also organizationally. Next slide, please. And in this, there's something called the 5 directions of trauma stewardship. And it really helps us to think about a way of navigating through this. And some people, again, might find this helpful. Other people may say this is way too hokey for me, Angie, and that's fine. But it's really a way of looking at it like creating space for inquiry. So thinking about, maybe this is how we start each of our days when we're starting to feel overwhelmed. Why am I doing what I'm doing, right? And why am I doing what I'm doing as far as the work I'm doing, but also why am I doing what I'm doing as far as maybe we're changing our behaviors. We're starting to feel impatient. We're starting to feel overwhelmed, right? Choosing our focus. Where am I putting my focus and what is my plan B? And then this also really goes into building compassion and community. So what can I do for myself and building compassion for myself? And then also, what are the things I can do in the environment around me? How can I get reconnected to this sense of community, right? So that we're not working in these silos and disconnected. And then finding balance, right? So these are the directions. And the reason why we need to do all of this really is for the 5th direction, which is, how do we center ourselves? Every day, how do we make sure that we have a sense of balance so that we don't get thrown off, so that we're not feeling overwhelmed, right? And this is a lot of self-reflection. I added this just because it might be something different, and even reading the book itself could be an activity or something that you can do in small groups or with your colleagues, or as something rather than a training or webinar. It could be something that you discuss together. But it can be really helpful, because when we're thinking about our own trauma and being triggered by some of this stuff, it's not about short-term fixes, right? I mean, we can figure out how to survive the day. How many of you are say like, oh God, I can't wait till 5 o'clock, right? But that's not really sustainable. And we don't want to lose, right? We don't want to lose the people doing this work, right? We don't want to always end up in burnout so that we can't continue to stay doing something that really we were drawn to do and that we get great satisfaction from. And so all of this is really to think about what are things that can be put into place that are beyond just getting by, but really might shift the way that we take care of ourselves and also how the way that we do our work. Next slide, please. So the trauma-informed organizational practices, and we've mentioned this before, this really kind of sums up a lot of the webinars we've done here, is the same as trauma-informed organizational practices, right? So vicarious trauma-informed is really the same, training and education. The first thing is, how do we raise awareness that this is a real thing, right? That this isn't staff that have a bad attitude or don't feel like doing their work, but that this is something that is a part of the work that we do. And how do we address this organizationally? Support and supervision has to be factored into it, right? We have to supervise, we have to guide, we have to provide support that is trauma-informed. It's really hard to do this without getting staff input. Staff have to feel, and staff have a right to voice their actual needs, what things are like, how it's being implemented. Sometimes decisions have to be made without that, of course, but if you really are thinking about shifting to a trauma-informed organization, vicarious trauma has to be part of that. And you can't really assume what people are experiencing. You have to find out what staff are experiencing, right, by having these conversations. And then, of course, communication and the overall work environment are all so important in providing more of a vicarious trauma-informed approach to supporting staff. Next slide, please. This is just a great visual. If we're thinking specifically around providers, I thought this was great because it really just reinforces everything that we're talking about here, right? That the collaboration is so essential. Partnerships and growth, building camaraderie and that connectedness, providing time and making time for reflection. So individual reflection and then reflection as an organization. And then those tangible, concrete things that really are about, if a person is feeling burnt out, what can we do with a person's workload, right? And really looking at processes and how we are doing what we're doing, and are there more efficient ways to do that so that there is more time to be able to do some of those other self-care things. Next slide, please. For small practice considerations, smaller teams may have a greater opportunity to support each other, right? And so it may be an environment that is more ripe to incorporate some of these things, and definitely to do things that are more peer supportive. On the flip side, vicarious trauma and compassion fatigue and burnout, it can quickly negatively impact a team, especially if it's a smaller practice, right? So it's going to, everyone's going to feel the effects of it much faster and probably in a deeper way, because resources are just limited and people are limited. But there are things that you can do in small practices that are harder to do in larger places, right? Which is maybe it's taking lunch all together at the same time. Maybe it's doing, some activities. Maybe it's not that, right? Maybe it's saying we want everyone to take time for themselves, and you can use that time however you choose, right? I don't know about you, but there have been times when like the last thing I want to do, and the furthest thing for me from self-care would be forcing me to eat with all these people right now because I'm frustrated. So maybe it's more around, hey, we can extend the time, or we'll all take turns so that each person gets 15 extra minutes to their lunch on a rotating basis, so that each person gets 15 minutes to go take a walk or go get a coffee or have some alone time, right? So you can think creatively about this, but really what this is all about is that it's important, right? And there are things that we can do to help prevent this from happening as often, but also that and that there's a lot we can do as individuals, but it's not all on the individual, right? And next slide. So people are asking about the resources. Here are some of those resources. Those a few of the self-assessment tools are there. The book that I've been referencing a lot is called Trauma Stewardship. It's really a great book, and it's a great book as an introductory book if this is all kind of newer to you. It's well written and can apply to anyone if you've been doing this for 20 years or 6 months.
Put the link to it on the in the chat.
Oh yeah. Oh, thank you. Thank you. And I think that's it. We would want to open this up now to questions or comments. I know that was a lot to talk about.
I just wanted to mention, we're still looking for some California small practices who have started implementing ACEs screening to talk to. The interviews would be 1 to 1.5 hours. We'll compensate your organization. So if you are interested in this or know someone who might be, please feel free to reach out to me. And I think that we can go to the next slide now. Yeah. So we're happy to take questions if you want to chat them in.
Some of you are writing such great comments to the panelists, and it's and I think they'd be great to share with everyone. I've experienced the same thing as far as taking lunch to eat with colleagues, or even taking lunch to eat felt like I was sacrificing time that I could use in multitasking. Right? There's probably most people here probably don't even take lunch. Like that's probably, and those are the things, right? Those are the things to really think about for yourselves. And I always have to remind myself too, or I'm mostly remote now. Yael's mostly remote in our work right now, and just reminding myself that I can get up from the laptop, right? I don't have to sit here and look at a screen for 8 or 9 straight hours, and that you have to get up and refuel yourself or get your steps in or watch something. Sometimes I put a funny rerun of a show I've seen 1,000 times on in the background just to hear something different or light, right? So whatever works.
Angie, do you see that question? How you identify trusted colleagues? Someone wrote, how do you identify trusted colleagues for networking and support?
Yeah, I thank you for bringing that up, right? Because that's really, if an organization is not really creating an environment that trust can flourish, right? If an organization is one where there's a lot of that there's rewards and punishments a lot, and rather than fostering kind of collaboration and open discussion and transparency, and even things like being able to say no, I really can't take that on right now. then it can be hard to feel like to identify trusted colleagues, or to feel like you can trust one another, because there's always the potential that you will almost be in competition, right? So I'd say, trusted colleagues can be either at your actual workplace. Sometimes I know in my organization, many of my staff who really need, a lot of, who need that time to process their own trauma work. Some of them do it with one another, but actually some of them seek out other forums. So it could be, online, it could be in person, of other people who have a similar role to you, and really kind of joining some of those forums that can help too. Not sure if I really answered that question, because I think it's also about just your own instincts and how you feel, right? Oh, thank you, Sunday. Absolutely. Hello, Henrietta. Oh.
Well, it looks like that might be all the questions or comments. Just want to really thank everybody for joining. Clearly, this is a topic that people are really relating to and feeling is relevant always, but clearly right now. Just as a reminder, you will get the link to the webinar, as well as the link to the last webinars that we've done. If you want to watch any of them, they've been recorded. You'll also be getting a link to an evaluation. If you could fill that out, that would be fabulous. And we really hope that we'll see you here next month, where we'll be talking about intimate partner violence and really digging into that particular form of trauma. So thank you all so much. Have a good rest of your day, and keep up the good work. You're all really changing lives.
Amazing. Thank you for being here.